speaker is Dr. Kala Baby Thottam, and she will be talking to you on her LASIK experience.
Good morning. Good morning, everyone. As Dr. Narayanagurti told, the popularity of PRK has come down when LASIK came, mainly because of the less postoperative pain and faster visual recovery. In LASIK, as you all know, what we do is we create a corneal flap, lamellar flap, and lift the flap and ablate. The excimer laser is ablated to the stromal bed, and the flap is repositioned. We can do LASIK either with microkeratome, mechanical microkeratome, or femtosecond laser. I'll be dealing with LASIK with a mechanical microkeratome flap creation. History, Jose Baraka is known as the father of refractive surgery. He invented the microkeratome, and Ioannis Pavlikaris in 1990s invented the hinge creation. And later, the microkeratome, what it comprises of a high precision oscillation blade system which docks into the suction ring and to create a lamellar corneal flap when the eye is held under high pressure. So various companies have come up with a mechanical microkeratome, the Moria, Bausch & Lomb, AMO. I think most of the companies have stopped manufacturing except for Moria because of the popularity of femtosecond laser. The microkeratome unit consists of a suction ring, cutting head, drive unit, and a central unit. There are various types of microkeratomes available: translational, rotational, linear, rotary. It's a video of LASIK procedure. After applying the topical anesthesia, we put the speculum and the ring is placed. Mostly I have used Zyoptics XP microkeratome. It gives a superior hinge. After applying the suction, use the head. It has got, it creates 160 and 180 microns flap thickness. Based on the corneal diameter and corneal thickness, we decide on the size of the flap as well as the thickness of the flap. We have we can create an 8.5 and a 9.5 millimeter flap. After the laser, excimer laser ablation, we replace the flap and align with the wash. Microkeratome, even though it is not so popular, but it is one of the main type of LASIK procedure, and it has we have done lots of surgeries without much problem. It is a proven history, and it compared to femtosecond laser, it's of the cost is very less, and the surgical movement is very fast because suction, we don't have to shift the patient to another bed or change to another room for flap lifting and repositioning. The same bed, we can finish the case, both eyes, in 15-20 minutes. And it can create a flap even with anterior stromal opacity, which is not possible with femtosecond laser. But even though it is simple and it has, we have done many cases without any complications, but there are a few complications, but it is even though it is rare, the most common complication is epithelial defect. It's because of the shear force of the microkeratome head and the flap irregularities. Mainly what we get is buttonhole, mostly in the steep corneas, or free cap in flatter corneas, and any type of incomplete flap. It can be due to loss of suction or inadequate suction, and Postoperatively, the first day the flap misalignment, maybe because of rubbing. It's a late complication of LASIK, an epithelial ingrowth. And one of the major complications of any refractive surgery procedure is undercorrection or overcorrection, and it can have regression and post-LASIK ectasia. So we should LASIK enhancements. We can consider LASIK enhancement. After a minimum, we have to wait for 6 months and wait for a refractive stability before we should attempt for LASIK enhancement. Thank you.
Thank you, Dr. Kala. This is a limited time. You have done it justice with a lot of clarity.